The World Health Organization has called it dangerous, unethical, but the White House is reportedly further embracing the idea of natural herd immunity, or as the LA Times editorial board puts it, just another way to say, let people die. The New York Times reports that during a call on Monday, two senior administration officials cited a controversial petition which opposes lockdowns and calls for safety measures only for people at highest risk, while encouraging others to, quote, live their lives normally to build up immunity to the virus through natural infection. The petition is called the Great Barrington Declaration, named after the western Massachusetts town where three epidemiologists met to write it. While virtually all of their colleagues believe it could cause hundreds of thousands of more deaths, but that's evidently not something weighing too heavily on the president's conscience as he holds packed rally after packed rally against the advice of his top disease expert and pushes conspiracy theories about his own immunity.
In the old days, they said, well, if you have it, you're immune for life, right? Once I got it, they give you 4 months. They say you're immune. You know, if it's anybody else but me, you're immune for life.
Once again, a reminder that COVID case rates are on the rise in all but a handful of states, and more than 216,000 people have died, adding up to a pandemic response so poor, according to the New England Journal of Medicine, that editors there felt compelled to break with a more than 200-year tradition of nonpartisanship, writing in a new editorial that the Trump administration has, quote, taken a crisis and turned it into a tragedy, adding, we should not abet them and enable the deaths of thousands more Americans by allowing them to keep their jobs. Joined now by the Dean of Brown University's School of Public Health, Dr. Ashish Jha. Doctor, it's good to see you as always.
Thank you for having me on.
Doctor, you, Governor Baker, virtually universal chorus has said as the weather gets colder, we should expect things to get worse in most of the nation. Are our state governments and are our people prepared for this?
You know, Jim, I'm worried we're not. I'm worried that all the talk that we've had for months about the coming second wave, people have hoped and I think prayed that somehow this doesn't happen. Unfortunately, we're seeing case numbers rise, and unfortunately, I think we are in for a lot more cases and a lot more infections, hospitalizations, and even deaths. And, you know, we can prevent a lot of it if we change our behavior, but I feel like people aren't really ready to hear that message.
Yeah, I'm so, I was about to say I'm so glad to hear you say that. I'm not glad to hear you say that at all, but it's an acknowledgement that it's almost like Groundhog Day. Is you turn on the television and people like you say all we have to do is wear a mask, socially distance, on and on like that. And the estimates of maybe a couple 100,000 more deaths by early next year could be sliced in half. But it appears that nobody who isn't listening now plans to listen in the future.
Yeah, you know, it's one of those things where we keep having to learn the lesson the hard way. We obviously learned it very hard in Massachusetts and New York in April and May. And folks in Arizona, Texas, Florida decided to ignore it and learn it themselves in June and July. And folks in the Dakotas and Iowa decided to ignore all of that and learn it themselves in September and October. And it feels like we're going to want to learn it again. And it's like, we know what to do here. We can protect people. A vaccine is coming. Like, we have about 3 to 4 months of really tough times. If we just do a bunch of stuff, we can get through this without getting into a lot of trouble.
You mentioned Massachusetts in April and May. There's a story in the Globe today talking about how our death rates have been, quote, stubbornly high throughout the summer. And they go on to say the obvious. Best hospitals in the world, with all due respect to Rhode Island, highest level of insured. How do you explain this?
Yeah, because it's a really serious disease. And the bottom line is that even with the best medical care in the world, and I do think Boston hospitals are some of the best, right after the Providence hospitals, the bottom line is that despite great medical care, it's not enough. This is a deadly disease, and for some proportion of people, terrific care isn't going to bail us out of it.
When you read analyses that say, studies that say that very few states are actually curbing the virus, and atop the list are some neighboring states like Maine and Vermont, my initial response is, well, they're amongst the least diverse states, which makes it easier to get to that bottom line. Is there more to it in terms of those two states? Is there more that we should be borrowing in terms of preventive measures here in Rhode Island and elsewhere?
Yeah. So, look, I do think part of the advantages that Maine and New Hampshire and Vermont have is not just not so diverse, but also they're pretty rural, and they have a lot of social distancing built in. Right. And we have a lot more urban areas, both in Massachusetts and Rhode Island. We have places where you have a lot of multi-generational family homes. So those are more challenging places to deal with. I still think there's a lot more that we all could be doing. It's not like we're doing everything we can. But there are some advantages that some states have that we don't.
You know, against this backdrop of almost universal bad news in virtually every state, a colleague of yours, I think she's an economist, Emily Oster at Braude, did a study the other day that to me was totally counterintuitive, basically saying that all the fears that so many of us had, particularly parents of young kids had, about the schools being spreaders or super spreaders, have been belied by the data. Do you buy it? And if you do, what's the moral of that story?
Yeah, so a huge fan of Professor Oster, and I agree with much of what she has to say, but not all of it. So let me tell you how I think my sort of thinking on schools has shifted a little bit. When we went into the summer, and when we came out of the summer and went into the fall, my general take was that in communities with low community spread, you got to start opening schools, and in places like Florida, Texas, you can't open schools. Well, guess what? The Florida governor did not listen to me, and he opened schools anyway. And I was very worried that what you'd see is large outbreaks in those schools. And the evidence so far, and it's not foolproof, but the evidence so far is that we're not seeing big outbreaks in school, especially not in K through 5. And so that has been evidence that has gotten me to feel like we should push harder on getting schools open. We should not be as fearful. Again, I think if you follow the rules of wearing masks, having some amount of ventilation, opening windows in schools, you probably can run schools pretty safely in most parts of the country. Certainly in Massachusetts, every public school K through 5 should be fully open. The fact that it is not, in my mind, is a travesty at this point.
Even in cities in Massachusetts that are considered red zones, would you say the same thing? Which is
Yes.
virtually every major city in the state.
Well, yes, if you look at Boston, and again, the case numbers are rising, and so we have to think about that as a backdrop. But at the same time, we're opening up more restaurants and bars. And my general take is we got to get our priorities straight. I mean, if we feel like it's too risky for schools, what are we doing with bars? Yeah. So there is an element of priorities. But yeah, like, look, what Florida opened up to was much, much higher than where Boston is today. And I'm not saying just open up willy-nilly and do nothing. Like, universal masking, work on ventilation. Again, you could open up windows. But I do think for K through 5, the risk benefit at this point is pretty clearly towards opening schools. For older kids, I'd like to see more testing in schools, and I'd like to see more data come in before we make definitive decisions. But even there, we probably should be opening more than we have.
Most people think the New England Journal of Medicine is maybe the most prestigious journal of its kind of them all. For 208 years, they have not either backed or condemned a candidate. And while they never said the name Trump or Biden, they excoriated the behavior of the Trump administration vis-a-vis this disease. Were you surprised, and do you think they did the right thing?
I do think they did the right thing. I was a little surprised only because 208 years of tradition is not easy to break. But this is an unprecedented situation. It's certainly the worst pandemic in a century. And the performance of this administration in the biggest public health crisis in a century is abysmal. And therefore, I think the New England Journal, recognizing that all the things that they publish, all of that is trivial. I shouldn't say it's trivial, but the health effects of that are small compared to the massive health effects of a botched pandemic response. I get why they felt compelled to do this, and I support them. I think they did it right.
How bad an idea is this natural herd immunity thing that is rearing its head yet again in the White House?
This is a terrible idea. And let's just talk very briefly about why. First of all, you're looking at many, many hundreds of thousands of additional Americans dying unnecessarily. So that's bad unto itself. We have no idea what the long-term consequences are of surviving COVID in people who do survive. So it's not like surviving is no big deal. Third, herd immunity is often not sustainable because we don't know how long immunity lasts. So it's one of those things where it'll kill a lot of people and it probably won't work. I suppose beyond that, it might be an okay idea, but I mean, I don't mean to be flippant about this, Jim. It's just, there are just not very many serious people who think this is worth doing.
Speaking of Groundhog Day, I have my Groundhog Day almost every day when it comes to one issue. I asked you a few months ago if you thought that all of the public health experts in Washington should resign en masse. You said no. Dr. Ezekiel Emanuel was here last night as an ethicist, and I asked him if there was an ethical obligation on the part of other people other than Fauci, who does do the right thing, the head of the FDA, the head of the CDC, on and on down the line, Dr. Birx, to stand up when an idea like natural herd immunity, or when the president does these sadistic rallies and deadly rallies in Pennsylvania and Florida. He didn't answer the question, with all due respect to him. He mostly praised Fauci. Is there not an obligation, ethical or otherwise, on the top public health people, even if they work for the president, maybe not to go as far as the New England Journal of Medicine, but at least to provide a counterweight to deadly advice coming out of the White House?
Yeah, this is a very serious ethical quandary. The statement I have made both publicly and in my private conversations with several of the people you mentioned is asking them whether they're doing more harm or more good by staying in the role they're in. I think people like Dr. Redfield, Bob Redfield, his primary job is to defend the CDC and make sure that CDC is performing the way it can. He is failing in that job. I think he has to take a very hard look at himself in the mirror and ask, is he doing more harm than good? At this point, I think he's doing more harm than good, but he's got to make his own assessment. I think each of them are doing their own role, and they each have to ask themselves this. I think Tony Fauci is clearly doing more good than harm, and I'm glad he's staying in. But boy, it's a tough ethical situation for all of them.
Well, I don't want to put words in your mouth, but before you go, so you're slightly changing your position. If the litmus test is, are you doing more harm than good, and you are doing more harm than good, then you think it's time to go.
I think if I were in their position, and I've served as an advisor in government, and I've always felt that if I was doing more harm than good, it was time for me to leave.
Dr. Jha, you're doing more good than virtually anybody else right here and elsewhere. Thank you so much for your time, as always.
Thank you. Thanks, Jim.
Appreciate it.